Good evening. My name is Justin Paiva. I'm the Chief Synergy Officer here at Health Products for You. We're happy that you joined us. Our team here at HPFY is very excited about this tonight's presentation, our April webinar. For nearly 20 years, Health Products for You and its associated brand Shop Nebulizer has been a premier retailer of medical equipment and supplies. And we're happy to bring you this series. We've really been listening for a number of years to our customers, and there's a real genuine need for content that is really an extension of the care continuum, and so we're really proud to present this information. I'm pleased to be joined by Laura Castrocone. She's our Certified Respiratory Therapist. She's has over 30 years of experience in a variety of settings, so we look forward to hearing her good experience this evening and help us through this major topic of sleep and wellness. The Q&A section is open, so please feel free as we're going through the evening to go ahead and post any questions you may have. This webinar is really based around sleep and its associated health and wellness, but at its core, at its heart, is really anything dealing with respiratory health. And Laura is a fantastic resource, so feel free to ask any questions related to anything beyond sleep as well as relative to respiratory health and wellness. So we'll get into our discussion this evening. Laura, glad to be joined with you this evening.
Thanks for having me.
Look forward to a little conversation together. Now, first, Laura, maybe you can help us all to appreciate what makes for good sleep. That's a question we get all the time.
Well, we live in a 24-hour society now, so it's really more elusive than it ever was. We call this in the field of sleep medicine, we call it sleep hygiene. And what it means is trying to treat your environment so it's conducive to sleep. One of the big problems is we use our bedrooms, especially people that are working home now. We tend to use our bedroom for everything, including sleeping. And we try to sleep in a room that we also have a television in, a computer, our cell phone, the kids, the dogs, food, work. It's just not an appropriate place to do that. So the first thing you should do is always take a look, especially kids too, get some of those electronics out of their bedrooms, because it's a very big problem in our youth as well. They don't sleep well, and their sleep patterns are very different when they go through puberty. There's a lot of different aspects of sleep.
Yeah, I'm guilty of that. I've got that iPad in there and that television in there. So.
I remember that light, the blue light on your phone and your iPad and your computer tricks your body into believing that it's daytime, and it may try to stop producing melatonin, so that way you stay awake.
Okay, good to know.
Yeah.
Well, then can you help us to understand what is apnea?
Oh, there are different types of apnea, sleep apnea. But when we talk about sleep apnea in general, people are talking about obstructive sleep apnea, which is actually a mechanical problem somewhere in the airway. And it doesn't matter what sex you are. Well, it does favor men as they age, tend to get a bigger neck. If you put on weight as you age, you tend to put on pillars of tissue around your airway, which crowds the airway and makes it more narrow. Some people have blocked sinuses and other problems that cause them not to be able to breathe through their nose. So they become mouth breathers. A lot of people have problems with tonsils and adenoids that are inflamed and blocking the airway. So it's actually a mechanical problem where your airway actually collapses down or narrows during sleep. And as a consequence of that, you snore. And that's usually what the bed partner complains about. And then you wake up because your body's oxygen level starts to drop, and it triggers a receptor in your brain to wake you up, so that way you don't have low oxygen levels while you sleep and ultimately not wake up at all. Yeah. So your body's a phenomenal tool to keep waking you up, but the consequence of that is you're always tired during the day.
You brought up something interesting. What are some of the dangers of unchecked apnea if we were to just ignore it and just say that's...
So if you were diagnosed or you thought you might have sleep apnea, but you were reluctant to treat it in any way, shape, or form, what you probably could look forward to is obesity. And with obesity comes increase in different chemicals in your body that cause you to become a lot of times diabetic. We see a lot of diabetes coupled in because of the increase in weight. We see a lot of heart failure because ultimately your heart and your lungs work together, and the oxygen deprivation during the night is going to affect your heart. And in newer studies, we know dementia is directly related to not untreated sleep apnea. As you deprive your body of oxygen, you also deprive your brain of oxygen. So over the course of many years of not treating it, not to mention the social aspects of it. We have bed partners that split up into separate rooms. We have people that get divorced. We have cranky people. You're cranky if you don't get enough sleep. So we see that a lot.
So that is really interesting. I mean, it really helps us to see how sleep connects to every aspect of life and
Absolutely.
the dangers of leaving it unchecked. So good. Now maybe you can tell us about CPAP therapy. Maybe some of our ones that are watching this live or on the recording are going to be interested in what it is about CPAP therapy. Maybe they've recently been diagnosed and they're working their way through this process.
So if you've recently been diagnosed or you need to check it out, the gold standard in treatment is still CPAP therapy. A lot of people think it's the, I've heard it called the diagnosis du jour, as like that healthcare is just making up stuff to treat people. But I have seen some phenomenal turnarounds of people who had so many problems with their sleep apnea, got on a sleep apnea machine, a CPAP in particular, and were treated in a few months. They felt like a new person. So what a CPAP does, and what the acronym CPAP stands for, is continuous positive airway pressure. So what it means is that with a CPAP, it's continuous. Whether you're inhaling or exhaling, there's always a stream of positive pressure air coming in towards you to keep your airway splinted open. So it's basically, very simply, a pneumatic splint for your airway to keep it from collapsing down. And it's non-invasive. And that's the important key buzzword about this treatment, is that you're not taking a drug, you're not being cut, you're not going through surgery. There's nothing dangerous about CPAP therapy. And if your doctor thought it was not something you should have, they'd discuss that with you for whatever reason. But it's pretty, we have children, we have babies on it, all the way up to people that are in their 100.
Very interesting. So, okay, well then, now that we have all that in mind, maybe we can start to talk about, obviously, Health Products for You, Shop Nebulizer, we're authorized retailers for the Philips Dream Station, which you have in front of you. Maybe you can tell us what we can expect when we receive a unit just like, a product just like the Philips Dream Station that you have.
Well, I want you to know the entire time we were talking, this has been running. So I want people to understand how quiet these are, because that's the first concern I get from anybody that has a bed partner or people that live in the home. How loud is this machine? Is this going to disturb the person I sleep with? So the Dream Station, as you can see, that's why they call it the Dream Station. It's not going to disturb your sleep. It's not going to disturb your bed partner's sleep.
Interesting.
And running the entire time. Now, this machine is a dream. I love this machine. This is a great tool for treatment. It comes in the box. Normally you'll purchase it, and you want to purchase it with this heated humidifier, because it's very important in this day and age for everybody to have heated humidity. There's a little door that opens here, and a chamber that holds probably about 2 cups of water. And you'll use distilled water for that. That's important as well, because we don't want to introduce any kind of bacterium from well water or tap water and all the calcium deposits that you get from that. The Dream Station is a very, very quiet machine. It's very operator friendly. It has internal mechanisms so that way it can be queued to your phone on your Bluetooth, and you'll be able to get a report every day on how you're doing. There's an app that goes with this. So it's very, it's the state of the art. And what's nice about the Dream Station is that if you were to travel, you could press this button right here on the side and disengage the 2 pieces. A lot of people ask me, listen, this is really heavy, but I'm going someplace tropical. I don't need humidification. So now you have a nice little compact machine that you could carry with you. You can even carry this in an overnight bag. It is permitted on a plane. They don't allow you to use it on a plane, but you can carry it free of charge. And it's accepted in every country, and it's already pre-converted electronically so that we can use it in any country in the world. And you're not going to blow a fuse. I've been around long enough to tell you that they weren't always like this. You had to change the fuse, and you had to flip a switch, and now it's all pre-converted. And in case someone doesn't have the capability of putting it on Bluetooth, it comes equipped with a data card, a standard SD card. And this can be read by a physician, a durable medical equipment company, I'm not sure if Respironics shares a program for you to download it to, because it does have information on there that you probably wouldn't understand. Some of it's more for the physician. And this is a great tool so your doctor can keep up with your therapy and make changes if need be. I love the Dream Station. This is a great, I've been using this for many, many years since its inception, since it came out, and have had great response to this particular piece of equipment. Quiet, durable, compact if you need it to be. Very good humidification. You have 5 different settings, so you can adjust it accordingly, and you may need to adjust it differently every time you go someplace, depending on the environment you're sleeping in. So that makes it more, you could turn off the heating element, make cool pass over humidification if you want to. And of course you have the ability also to see on the screens all your data as soon as you get off in the morning, so you can see what's going on.
Nice, nice. Well, that kind of sets us up for when we've received it, we're putting it together or making a decision on what unit we're going to make a purchase on. So
absolutely
good. Now, obviously, it's directly connected to us. So, what can you help us to appreciate about hygiene, keeping in mind for cleaning and maintenance and those types of things?
It's very important. People don't realize you have to treat this like every other appliance that you have, except for remember you're using it nightly. So your water chamber needs to be emptied every day. And a lot of people think it's a waste of water, but I've seen these things grow some pretty harsh bacteria. There's corners and stuff in here, and no matter how hard you try, a lot of times these get soiled, and you should dump the water nightly and let it air dry. Wash it if you have the time. If not, at least wash it a couple times a week with soap and water and rinse it. Don't have a temptation to put any essential oils or anything foreign in here, because the machines have at least a 2-year warranty on them, and they may gum up the works, or inhaling it might be dangerous to your airway. We have a lot of questions about that. So maintenance wise, you're going to want to dump your water every day, and whatever device you're using on your face, whatever mask you're using, you're going to want to wash the parts that touch your skin daily. Because if you don't, what happens is it ends up picking up a lot of facial oils, and it doesn't seal as well. And sometimes it can grow bacterium. And if you have any open sores on your face, or men who shave, a lot of times will have an open wound without even realizing it. You can introduce some bacterium in there and cause an infection. So you do have to keep these things clean. We also sell cleaners that make it very easy to do that, like the So Clean and things like that. But if you're not going to invest in something like that, which I think is a great investment, you have to use soap and water. And I always tell people, plain soap and water that you always use on your skin. Don't be using dish soap or foreign soaps you've never used before, because that's usually a prescription to break out. Or if you break out and your skin is raw, you're not going to want to use your CPAP. So it's kind of a vicious cycle. As far as other cleaning and maintenance, these machines come equipped with filters, and they draw in room air from your home. So if you have pets, or if there's multiple smokers in the home, or you burn a lot of wood or any kind of fossil fuel in the home, you're going to get a lot of dirt and deposits of these. You have to change these. It's recommended to change the filter, the disposable filter monthly, and the reusable filter, you can wash it and change that every 6 months. It's recommended to replace this water chamber approximately every 6 months. Don't let it go longer than that. It really gets yucky after a while, but you can clean it with plain soap and water. This one is top rack dishwasher safe. In case you don't know, you can put it in the top rack. It's not too hot up there. This also has tubing that goes to it. The tubing should be rinsed every day and washed out and hung to dry. If you don't want to do it daily, and I know that seems like a lot of stuff, I tell people, take it in the shower with you. Make your life easy. It's a double female tubing, so you're going to hold it up in the shower, get a little soap and water in there, swish it around, rinse it well, and hang it over the shower bar and let it dry. Make your life easy. I tell people, most people take a shower before they go to work or whatever they do in the morning. So take your mask in there as well and launder it in there, so you don't have extra steps. Take your water chamber in there. You're the only one using it. So wash it the way you want to, but make sure it gets done daily, especially dumping the water, because if any bacteria is going to grow, it's going to grow in stagnant water that sits by your bedside that keeps being heated and cooled and heated and cooled. This is the part that people, when they say I got sick from my CPAP, it's usually because they've introduced some bacteria into their airway. As far as your mask goes, that should be the cushions that touch your face, or seals or pillows, whatever style you're using. Those should be replaced monthly, and the frame of the mask quarterly. And your head straps, If you're going to change masks, obviously you have to change the headgear. They're not usually universal, but normally that's every 6 months. By then it needs it, even though you're laundering it. And a good way to launder that is by hand, or if you have a small lingerie bag that you use for delicate laundry, you can put it in there and throw it in your laundry and put it on top of the dryer to dry.
Yeah, that all makes a lot of sense, especially like the common everyday tips, because we all live very busy lives, and adding one more routine to it is
Right.
challenging. So, but again, you highlighted that if we don't do that, we're going to either not do the therapy, or we're going to introduce other harmful
Right. You don't
bacteria
want to,
into our life.
right. You don't want to make this more complicated than it is. It's not a complicated therapy, but it's it's not a dangerous therapy, but you can make it dangerous for yourself by not doing the proper procedures, cleaning and stuff.
Now, we've kind of gone through some of the mechanical things, but this can seem a bit overwhelming. I know hearing about it, and I'm not using the therapy as of yet in my life, but it seems a little bit overwhelming. It could be, a little bit scary, some of the comorbidities that you talked about and those types of things. So if we're new to the therapy, are there any tips on kind of how to deal with it emotionally and kind of work ourselves through this new therapy that we're using?
Well, I've been teaching people how to use this for about 30 years. And in my experience, the people that are successful don't force it on themselves. Don't force yourself. If you don't want to do it the first night, don't. But remember, you got to at least try. So what I tell people a lot of times is put the mask on and walk around with the mask on, just so you get the feeling of what it's like on your face. You can still breathe through your mouth and you're not going to suffocate. And then put it on with the airflow running, just while you're awake and alert, so you know what to expect. And take it off if you're uncomfortable. You're not going to be comfortable in the beginning. I'm not going to lie to you. It's not the easiest therapy to get used to, but the alternatives are not very good. So that's what, as a respiratory therapist, people that work in a sleep lab, we're here to support people to help them get used to this, because we know once they turn that corner and they do start using it regularly, a lot of things in their life are going to change. No more falling asleep at your desk. No more falling asleep at the wheel. No more feeling, tired all the time like you never got sleep. No, hopefully your weight starts to decrease. There's a lot of good things to look forward to, and you feel better. Depression might start to lift. So I tell people, work with it at your pace, but if you're not able to do it within the first 2 weeks, you have to let somebody know, your doctor, whatever, because he's going to have you come back for a follow-up more than likely, or touch base with him on how you're doing with this. And there's not going to be the information for him to see whether or not the treatment's actually working. You're not going to feel different in the beginning. A lot of doctors will say, you're going to feel like $1 million. You're going to lose weight as soon as you start using it. The truth is that all happens over time. It's not very few. I have set up thousands, literally thousands of people on CPAP, and a handful will say, oh my God, next morning I woke up and I felt fantastic. Most people, it's just using it and being persistent. And then finally they realize, oh yeah, I'm not waking up in the middle of the night to go to the bathroom 10 times. I feel awake when I get up in the morning. Sometimes the changes are subtle, and the spouse or the bed partner may notice the changes, or people that live in the house may notice the changes. We hear people saying, he's not as cranky as he was. I see him smiling a lot more, paying attention at work. You lose your ability to be cognitively with it. But when you're tired all the time, it's, if you've ever had children and you've been up all night, that's what it feels like, but only every day, and it accumulates. It's what we call sleep debt, and it's very hard to pay back. So what you can look forward to is, emotionally, it's going to be difficult, but it's not the end of the world. It's, you're going to get used to it. And if you don't, you're going to have a discussion with your physician on what the alternatives are. But this is going to be the gold standard. This is the easiest therapy to get used to. And there's a lot of support. There's groups online, there's support groups all over, to help you get through all this.
Yeah. Thank you for that, Laura. It's nice to be able to hear that, even though it's overwhelming, that there's good success at the end. It has
a lot of success. Yeah.
So having that positive outset will help that. So you brought up something interesting. What about sleep partners? What can they expect as far as managing? And you had that great demonstration of it being on the whole time.
Right.
And so it's not this loud running engine, but what can the sleep partner expect?
Well, right now, the sleep partner is probably, if they haven't been banished the person with the obstructive sleep apnea to another room and they're sleeping in the same room, their sleep is disturbed as well. So when someone has sleep apnea, the person that sleeps with them also ends up having a form of sleep disturbance because this person is snoring. They're restless throughout the night. They make multiple position changes, so they move around a lot, and it has a lot to do with the brain being woken up all night long. So the bed partner's sleep is disturbed as well. So a lot of times that's a real bone of contention between couples. Listening to somebody snore all night is not a very pleasant trip to bed. So what we can expect once we start using the CPAP is hopefully our goal is to get couples back in bed together. If they want to be, we want to get them back in the same room together so that way they both can benefit from the sleep therapy, the person that's using it and the bed partner now finally gets a good night's sleep. We find that patients that start using it, they don't thrash around in bed anymore. That's great for the bed partner. We find that patients that use sleep apnea start to become healthier and their weight starts to go down. And ultimately that trickles down to the whole family because the goal is to get you to live longer and be around longer so you can take care of your family. People don't take this very seriously. They think snoring is just a noise that's made in your airway and they don't even understand why. It's a warning sign that your airway is crowded. We hear it even in children. But with children, they go in, they take out your tonsils and adenoids and they make the airway bigger so that way they can breathe. Usually with adults, it's not that simple. So we do see, and usually with adults, as we age, we tend to put on weight in places that we crowd our airway. We put on weight in our middle section, and all that compresses our ability to breathe properly when we sleep.
Yeah. Well, Laura, thank you so much. Excellent information. Again, we appreciate the good clinical content and how to deal with it. We need to understand these things as we kind of go through these therapies, and so we appreciate it very much. So far, Laura, we haven't received any questions this evening, so we'll make that available. But it doesn't look like we have too many questions this night, so you nailed all the information. We don't have any questions.
I hope so. If you have any questions, feel free to reach out to someone in the company or myself, so we can help you move forward with a decision on either getting a CPAP, managing what you already have, replenishing your supplies, which is very important. You want to keep those up so that way you can continue with your therapy, because once you feel better, if you have I have people that have power failures and like, oh, it was the worst night of my life. I couldn't use my CPAP. So you do turn the corner and get to the point where this is your bedtime buddy.
Yeah. For all those that are attending in the live webinar or in the recorded session, our phone number is 866-316-0162. You can ask for Laura or I, and we'll get you in contact and get you good information so that you can make a good decision on whether you're going to make a purchase of a product or have questions. We can steer you in the right direction there. Well, Laura, since we don't have any open questions, we'll go ahead and conclude this webinar. Thank our attendees, and we
Thanks
look
for being
forward
here,
to
everybody.
our next webinar. Again, this is a monthly webinar. Our next one is Thursday, May the 27th at 7 p.m. So we hope more can join us then as well. All right, Laura, have a great evening.
You guys too. Thank you for being here.
All right, bye-bye.
Bye-bye.